Good morning. My name is Remigiusz Kazimierczyk and I work in the Department of Cardiology at Medical University of Białystok in Poland. Dear Chairman, thank you very much for a possibility to present you here today our study entitled The Relationship between Right Ventricular Arterial Coupling and Cardiac Metabolism in Pulmonary Arterial Hypertension, a multimodal study. I have nothing to declare. Ladies and gentlemen, but what is coupling? Coupling is a relationship between ventricular contractility and afterload. Until the balance between those two parameters is preserved, the ventricle is capable to pump the blood efficiently. In case of pulmonary arterial hypertension, with further increase of an afterload, right ventricle becomes unable to proportionally enhance its contractility. It dilates, glucose metabolism is increasing due to higher metabolic demand, and this altogether leads to right heart failure. And it was confirmed that maintained RV systolic function is crucial for PAH patients' prognosis. So it is very important to assess this function, especially before clinical deterioration. In our previous study, we confirmed that impaired RV function is associated with higher glucose metabolism, higher glucose uptake of RV myocytes in PET imaging. The uptake of glucose measured as a parameter called SUV was also linked with worse prognosis. In this study, we propose an echo approach for obtaining coupling. And our main aim was to verify its prognostic value, and secondly, check the relationship between echo coupling parameter and altered glucose metabolism in PET. But how we did it? As I said before, coupling is a relationship between contractility and afterload. As a measure of contractility, we used TAPSI, and as a measure of afterload, we used echo-estimated systolic pulmonary artery pressure. Into the study, we enrolled 26 PAH patients and 16 healthy volunteers as a control group. As you can see, during baseline visit, we performed echocardiography, right heart catheterization, and PET MRI hybrid imaging. PAH patients had elevated pulmonary artery pressures both in echocardiography and right heart catheterization. They had also higher glucose uptake of right ventricle, and our coupling parameter, TAPSI to SPAP ratio, was 0.35 in PAH group. Interestingly, this coupling parameter significantly correlated with other measurements, for instance, from MRI, like right ventricular ejection fraction, from catheterization, like pulmonary vascular resistance, and, as you can see on this figure, with higher glucose uptake of right ventricle in PET imaging. Then we observed our patients for almost 2 years, and we defined composite endpoint as death or hospitalization due to PAH progression. 16 patients who experienced composite endpoint had significantly higher pulmonary pressures both in echocardiography and catheterization, higher glucose uptake of right ventricle in PET imaging, and, as you can see, lower TAPSI to SPAP ratio. Then, in ROC analysis, we obtained the significant cutoff value of TAPSI to SPAP ratio in predicting composite endpoint, and this value was 0.25. Interestingly, area under curve was significantly higher for TAPSI to SPAP ratio than for TAPSI alone. And as you can see on this figure, patients with TAPSI to SPAP ratio lower than 0.25 had worse prognosis. Ladies and gentlemen, pulmonary arterial hypertension is a serious and progressive disease, and we still need new prognostic parameters. Proposed echocardiographic approach for estimating right ventricular arterial coupling offers the potential non-invasive prognostic parameter for more comprehensive assessment of hemodynamic state of PAH patients even at bedside. It is significantly correlated with invasive measurements as well as PET MRI parameters. Selecting PAH patients with nearly uncoupled heart with altered glucose metabolism before clinical deterioration seems to be promising, but this requires further studies. Thank you.
So I will have the honor to ask Thomas.
Well, first of all, I must thank you very much for kind of bringing echocardiography back into this assessment of right ventricular function, because maybe for you out there, coupling is probably one of the most in my view, best parameters to really assess right ventricle function. And we are losing ground to catheter. So by creating a parameter that uses echo seems very intriguing. Have you thought of maybe using something else except for TAPSE as right ventricle function, such as strain maybe?
Yes, of course. There are many ways to estimate a contractility part of a coupling. Firstly, we use TAPSE because it's quite feasible and easy to obtain, even at bedside. But in the next step, we're considering using a global longitudinal strain from echocardiography, and then maybe other parameters of RV systolic function, like T index or S', or maybe a fractional area change.
Yeah, I think that's probably a good idea. I don't know how you see it, but maybe you want to just comment on the role of this parameter?
Yeah, I agree with Thomas. You should use other parameters to match pulmonary pressure to RV contractility, maybe strain parameters. And is systolic pulmonary pressure a good marker to measure the right afterload, in your opinion?
Also, it is only an estimation, of course. We also can use pulmonary artery compliance as well, and it could be the better one. But as I said before, in our first step, we try to use the most feasible parameters to do it actually at bedside, yes, during routine examination of PAH patients. In next step, we will use more advanced parameters and maybe more accurate ones.
Okay.
A very brief question by me. I do remember some studies that started something like 15 years ago having the same philosophy that an ischemic heart, a stress heart, always use the glycolytic substrate in a better way than lipids. Do you think that by exploring the metabolism of the right heart, this might have any clinical consequences in terms of giving metabolic, differentiators like, let's say, ranolazine or something like that to these patients?
Yes, actually, it's like in left ventricle, when right ventricle has failure, yes, the glucose metabolism is increasing, and actually, like it was confirmed for left ventricle, and even to right ventricle in pulmonary arterial hypertension, but we just combined this glucose uptake with other measurements from other procedures. It's called multimodal studies. So in my opinion, it's very interesting that during the baseline visit, patients who are actually stable have already altered glucose metabolism, and it's connected with uncoupling, nearly uncoupled heart.
So the Palares will be happy. You remember this gentleman a lot of years ago. He gave glucose insulin solutions for the left heart, and now maybe we will do it for the right. Excellent presentation.
Thank you very much.
Thank you very much. A very high scientific curiosity. Thank you very much.